Welcome back to the Principles of Healthcare. Today we are talking about something that almost every clinician has a strong opinion about: quality measures, CMS programs, HEDIS, star ratings, core measures. For some, these programs represent accountability and better outcomes. For others, they represent dashboards, abstractions, and late night documentation. But here's the reality: quality measures shape reimbursement, public reporting, staffing priorities, and increasingly strategic investments in technology. They're not optional, they define how healthcare organizations operate. So, the real question for today is this: as AI enters the system, does it amplify the burden, or does it finally help align measurement with meaningful care?
Before we dive further into today's topic, let me briefly introduce the panel, bringing diverse perspectives from across healthcare innovation. I'm Karen Vincent, a product leader with more than 10 years of experience in data-driven decision-making and digital transformation in healthcare. My focus is on readiness, governance, and performance measurements, helping organizations unlock the full potential of AI while ensuring it delivers measurable outcomes. And joining me is Prerna Anand.
Hi, everyone. I am Prerna Anand. I'm a product manager with over a decade of experience building AI-driven solutions for patients, providers, hospital systems, and payers. I focus on uncovering the real problem underneath the symptoms and designing technology that aligns strategy, workflow, and measurable performance. In the world of AI, especially in healthcare quality, that often means translating clinical and operational pain points into systems that actually work. And we're joined by Angel Shew.
I'm Angel Shew, and I've spent 20 years transforming healthcare operations at organizations like UCSF, Stanford, Kaiser Permanente, Medical University, South Carolina, turning complex technology initiatives into operational reality. And today I'm especially excited to introduce our guest, Robert Hinahan. Robert has spent his career connecting analytics, enterprise systems, and quality performance. From leading Epic implementations and core measure reporting to directing analytics and business applications at El Camino Health. He's been at the center of healthcare's digital evolution. Today, as founder of HEDIS, COO of Bastion GPT, and director of artificial intelligence at Cactus Healthcare Resources, he advises organizations on how to move from AI experimentation to real operational impact. Robert, welcome. To begin, how did your work in core measures and Epic reporting evolve into advising organizations on AI and quality today?
Thank you so much. It's a pleasure to be here and to talk with you guys. So my journey started at Epic. I graduated school thinking I was going to become a doctor like many in my family, but instead I went in to work at the company that was creating the software for doctors. And while I was there, I was working on the clinical documentation side right around the time that meaningful use was coming out. And that created a huge opportunity to help with quality measure reporting. So all the requirements as you implement EHRs was now that you had to be able to report data to earn your incentive payments. And so while I was at Epic, I was able to start joining the team that was doing core measures reporting as they moved from doing abstraction of patient charts to capturing data in real time and then being able to use that data to monitor and improve patient care. And after a few years at Epic, I decided to go into consulting. And so I worked for a company called Huron for a number of years, helping healthcare systems implement the technology I was working on while I was at Epic. And during that time, some new core measure sets came out around sepsis, which was really a big focus for me for a number of years. And then after that, I went and decided to join a healthcare system. So sort of going from the technology to implementing the technology with a consulting company to working in a healthcare system for a number of years, moving from the analytics side up to the leadership over all of the analytics and business intelligence, and then started to get into the business application side. And after a few years, I really wanted to get back onto the technology side. And so ever since the AI transformation that came in 2023 and 24, I've been working on my own consulting company called HEDIS, and working with a company called Bastion GPT. And Bastion GPT is a tool that provides healthcare organizations HIPAA compliant access to all the top AI models. So organizations can securely access all these different super powerful models from OpenAI, Google, and Anthropic. That's really, it's like a circle of technology to implementing it to managing it. And now I'm back on the technology development side. It's been a fun journey.
That's an incredible journey, developing, implementing, and managing technology in this space. I have a question for you. Clinicians often experience these programs as documentation burden. Is the problem the measures themselves or the workflows and reporting systems built around them?
It's definitely both. The measures themselves are oversimplifying very complicated diagnoses and care paths, but the documentation burden as well is also something that you're trying to make sure you're capturing everything that fits these very specific rules, and that's taking away your focus from the care. And so it's somebody's job to go back and audit all of that information to make sure that it's in the chart in the right place. And I always thought it was interesting when I was at Epic learning about the idea of reason for not. So there's this whole set of documentation you need to do to meet these measures to say why you're not doing something. So if you're either providing the right care, then it's going to check the box for you. But if not, you need to say why you're not doing it and whether that's in the right place in the chart or if that's on their problem list or if that's something that's in their medication list. It needs to be there. It needs to be set up in the reporting structure so that it can be captured. And then if it's not there, sometimes what organizations would do is they'd set up their pop-ups and BPAs. And so that would always make an extra burden on clinicians because they need to deal with something that's popping up into their workflow and telling them that they need to either change their care or document something that wasn't in the natural progression of how they're treating their patients. So the measures are complicated. You're trying to write complex rules for complex conditions, and then you're also burdening providers by trying to click the right boxes to make sure that they're meeting those rules.
Wow, that is quite complicated and a double-edged sword, if you may.
Yeah.
So, Robert, you've helped systems move metrics like stroke compliance significantly. What operational shifts make the biggest difference in improving in these measures?
So some of the biggest shifts come from the ability to use the technology that you've implemented to capture that data. And then one of the really cool things was you went from having the data and it was something you had to look at after days or weeks or months and see how are we trending on this to now be able to say, okay, for the patients that are currently admitted, how are we doing? Are they meeting the care that they need? And so there's often people whose job it is to just abstract patient charts for these diagnoses. So they know that treatment or that diagnosis and that process better than anyone else. And so what we found was once we had the right tools and then the opportunity to do concurrent or real-time reporting with Epic, you could now have that person or people with a similar job move into monitoring. So they could now start to use dashboards and reports to monitor patients and make sure that they're getting the care they need and that they're also checking the right boxes and getting those reasons for not documented. So it makes it so you've got the people that are really experts in this whole process and the requirements. They now have more of the ability to become a stroke advisor and a stroke partner or a stroke coordinator. There we go. A stroke coordinator instead of a stroke abstractor.
Wonderful. When we say AI and quality, what are we talking about? Is it predictive models, NLP for abstraction, summarization through LLMs, or all of the above? Can you help us break down the types of AI models currently being used in quality programs?
Yes, all of the above. AI in healthcare has really moved to now beyond predictive models, which we talked about, where you're using statistical analysis of these massive data sets that now exist thanks to EHRs. but we're also getting to NLP, which is natural language processing, where now you can continue to add to the data that can be evaluated because you can find it within unstructured data sources like notes or flow sheets that aren't discrete data. And so that is now giving you even more power as you start looking at LLMs that can summarize and present and analyze that in ways that we never could before. And it went from this idea of reporting based on rules, where you're saying, if this happened, then we're in compliance, or if this didn't happen, then we need to go and check this other status. But now with these tools, they can look at the whole picture and make sure that you don't even need to start going through this rule set. You can just tell whether or not things are in compliance based on the whole set of care that the patient's been through and their diagnosis, or even their care from other organizations as well that wasn't in this encounter. So now you have all of these tool sets. You have the rules for basic reporting. You've got predictive models using the predictive modeling tools in Epic. And then you've got now these more complex LLM structures that are doing indexing and frailty monitoring so that you can better identify patients and treat them before they're discharged instead of having to wait till you're checking whether or not you were compliant after they were already discharged and you're abstracting days later. AI has really transformed how we can use this data that we've been putting in ever since we implemented EHRs. The AI transformation has also been the value of the data transformation, because we implemented EHRs and we had all these fields to put data in. And then it was a pain to put all that data in. We had to document our reasons for not doing things. And now we can avoid having to do that because we hit the whole picture of the patient using unstructured data in areas that we wouldn't have thought to look into. But because we have LLMs, they can think that this actually might be relevant without us realizing that that is relevant because of the whole population they're looking at. So yes, predictive analytics, AI, it's just continuing to change, and it'll be really interesting to see how they create rules and measure sets now that we have AI.
This is amazing. I love talking about the growth we've seen in measures and models as this is evolving, and I really appreciate you taking the time to walk us through the landscape. I was wondering if you could take a moment to dive into a specific example that can help illustrate this evolution. Can you walk us through the journey of sepsis management and how Epic's predictive models change that landscape?
Yeah, no, sepsis was a great example. Something I got to be working on from 2015 when the new measures came out, working with organizations that were implementing Epic's core measures reporting tools. We got to then start working on how to implement reports and processes to monitor and manage sepsis. And it is a very complicated measure set that applies to a large number of patients. So it was a great opportunity to try and identify the specific patients that were going to be at risk or were going to meet the criteria. And so it was one of the earliest examples of Epic's new predictive model structure that they implemented in 2017. The goal was never to just give people a scoring system that they could use. It was to give them an infrastructure that they could use to monitor their own patients, do the analysis on their own data sets, and then create customized scoring that would help them effectively measure and monitor their patients. But that is a difficult undertaking that requires a higher level of understanding and a lot of resource management to put out there. And so they found that these were overly sensitive and they weren't accurately identifying patients. So a lot of clinicians became frustrated very quickly with the sepsis predictive model because it was firing alerts for them when they didn't apply, or they already knew the patient had sepsis, or some reason that now they don't trust this predictive model. And that was because the predictive model wasn't effectively trained on their patients, or wasn't necessarily trained in a way that was going to be effective more broadly. But now they've got whole new ways of developing their models using LLMs to actually continue to refine and improve. And it's amazing how much they're able to use AI now and how many new tools are coming out all the time. So I think one of the other major points with the sepsis problem or the sepsis opportunity was how much training and configuration was still needed to be done on the organization side. And so having worked also in management over an analytics team, they're so busy that it's so hard to find and take the time to really validate every single model that people want to use. And so now that's something that's much easier for organizations to roll out and benefit from these predictive models without, while still taking the time to validate them, they have an easier set of tools to do that with.
That's a great use case about testing, validation, and improvement and growth. I wanted to take a slight tangent and ask in a similar way, where should clinicians and professionals look to incorporate AI as they evolve their careers? Where can they grow, and how would you recommend they start about it?
Um, Well, I think they should start the way I started, which is you just start playing around with the generative AI models. You just start looking at and using ChatGPT and seeing the power that's there, and then going beyond just asking questions, but actually using it to help generate documents, and then going further and actually using it to educate yourself on how to write prompts, and then creating projects and GPTs so that you really can give yourself your own infrastructure to use AI. And one of my favorite tricks is I give it a nice whole problem and then ask that to help me write a prompt myself. So I get better at prompting because I'm using a prompt to ask for better prompts. So I think that's one of the great ways to continue to sort of shortcut how to use the AI tools, but then also to take part in communities. And there's so much free education online that you really, if you just take an hour a day or a couple hours a week, you'll see the crazy value that there is. And I mean, with all the benefit that people are getting from their AI scribes, maybe now they can take that pajama time and spend it learning some more AI tools. The other risk, though, that I also have challenged myself with is this idea of de-skilling. So
Mm.
sometimes you can become too focused on using AI, and that can keep you from being as sharp and critical as you were before. So if the tools are giving you the answers 99% of the time, that 1% of the time you're going to get it wrong, but you've already trusted it. Or it's gotten so good at writing emails for me, I don't even know how to write an email anymore. So I've instead gone back and for writing an email or a blog post, email is less of a problem, but I will have to write it all myself and then use the AI to help me refine it. So there's sort of a set of internal rules as well where you say, okay, I want this to represent me. I want to put my ideas out there and I want to make sure that I'm also reinforcing what I know, and then it can make it better or challenge me as well. So that's another great way to use the AI tools that say, hey, here's what I'm putting out there is challenge me, say where I'm wrong, and then I can help think about ways to defend myself. The other cool thing that I love doing is sort of creating large data sets of my own, health information or a whole library of certain teachings that I have that I now can go back and reference and talk to like an advisor that I've built a model for because I have everything that we've ever talked about together. And so now I can go in and ask a question and get what their response would be based on previous conversations.
Wow, those are great tips and advice we can all take on how to upskill our AI abilities. What step can quality leaders take today to prepare their organization for responsible AI adoption?
I think one of the keys is first to set up a governance structure. Um, I there's some AI group therapy sessions that I run, And that was the first topic for many, many people across organizations, healthcare, business, AI, was they just needed to have an infrastructure to help evaluate all the AI solutions that were out there. And then the next step was like, okay, that governance structure has to educate themselves and their stakeholders and then their whole organization on what is AI, how does it work, and how does it apply to your practice. So the other thing that's really important is to make sure you get buy-in so that it's not something that's just being done to these clinicians, but that you have healthcare providers that are seeing and experiencing the value, and it's not an IT solution that's being forced on them, but something that they are involved in from the very beginning. I think the other issue that comes up is the idea of shadow AI, and that's where a company like Bastion GPT is so important because shadow AI is something that when clinicians or anybody in a healthcare organization starts using AI on their own and they are asking a question to ChatGPT and they either put in patient information or they put in sensitive organization information, they violated HIPAA. And so that's why we built Bastion GPT to provide an alternative where it's giving you HIPAA compliant access to those same models. And so organizations use that as a way to give their employees and clinicians access to these models in a way that's safe and secure. People are going to use these tools. Make sure you give them a safe way to use it and then monitor to make sure that they're not violating HIPAA with other tools.
Well,
Yeah.
yeah, that's great. And that's actually the right way to think about it. Quality measures aren't going away, compliance is not going away, but how we operationalize them is evolving. If we design and govern AI intentionally, it can shift quality from retrospective reporting and too much documentation and triple documentation to proactive care, reducing burden while improving outcomes. Robert, thank you for joining us and giving us your perspective.
Thank you. It's been a pleasure.
Thank you for bringing both practical and strategic perspective to this conversation.
You've been listening to the Principles of Healthcare with Karen, Prerna, and myself. If today's conversation helped you think differently about AI and quality measures, share it with a colleague and subscribe so you don't miss future episodes.
This AI-IRL episode of Principles of Healthcare is produced by Prerna Anand, Karen Vincent, and Angel Shew. Our guest today was Robert Heenahan. This is Volume 2, Episode 1, Healthcare Quality in AI. This episode was scripted by Prerna Anand with guest coordination by Angel Shew and recording, editing, and production by Karen Vincent. Background music, My Artificial Intelligence. Audio source, Music Revolution, licensed through Adobe Stock. Stock footage by Visual Lab, licensed through Adobe Stock. This podcast is for informational and educational purposes only and does not constitute professional advice. Special thanks to our listeners, mentors, and the healthcare community for your support. We would love to hear from you. If you have questions, topic suggestions, or potential guest recommendations, please visit bit.ly/AI-IRL. Stay connected. Follow us on LinkedIn. You can use the QR codes on our credits page to connect with Prerna, Karen, or Angel. This is Karen Vincent signing off. Thank you for listening.